and not to say that there's never any stress, but I would say compared to the stress levels that I had it pales in comparison. So like my time is spent so much more efficient and smarter. But plus is you're not like in the hamster wheel that you're feeling that you have to, you're thinking about other patients are waiting for you. You can actually spend the time that you need. So it's a very...
Nothing in this podcast is intended to render legal, financial, medical, or other professional information. Because the details of your situation are fact-dependent, we highly encourage you to find a recommended individual that you can trust to give you the expertise that you need related to your situation. In Docpreneur Nation, you're listening to Concierge Medicine Today's Docpreneur Leadership Podcast, and today we have a special guest and a really fascinating topic related to hospital and health system concierge medicine programs. Dr. Aaron Klein, he's a DO with Baptist Health Concierge Medicine. Dr. Aaron Klein in Florida, Boca Raton, kind of one of the home bases or headquarters of concierge medicine programs, very popular in Florida. Dr. Klein, thank you for being our guest today.
My pleasure. Thank you for having me. Looking forward to spending some time together.
Absolutely. I love podcasts because they're, I over the years of doing podcasts, I have, what better medium do you have to sit in front of a doctor or in a subject matter expert for like an hour, 2 hours? I mean, we can't even get that from our own doctors these days. So the knowledge base that you're able to share in these mediums is pretty amazing. You can go really in depth. But Dr. Klein is
my pleasure. Yeah, my pleasure to contribute.
Yeah. So before we jump into where you're at, what you're doing with Baptist Health Concierge, tell us a little bit about how you became. What drew you into being a doctor? Was it family business? Was it just like, hey, I just really enjoyed, or maybe it was a personal story?
So really, actually, I have no relatives actually in the medical field. So it was kind of, something that I just, when I was, in grade school, I always just gravitated towards science. I was always interested in, the human body, but also I always just liked people. I liked interacting with people, and as a result, it just kind of seemed like a natural fit for me. And so like, as I, really continue to go along, I would occasionally do things like volunteering and it just kept reinforcing the fact that really this is where I should be going to. And at no point actually in my past did I ever think I was actually going to do anything else but become a physician. So actually, my parents never pushed me into it. I had no relatives that were in it. It was really just something that I always kind of knew that I wanted to do. And just the more I did and the more I ensconced myself in the field, the more I realized that reinforced is like, you know what, this is the right way to go. And looking back, people can say like, well, if you could do it all over again, would you do something different? And I said, I am exactly where I want to be in my life. I'm doing exactly what I want. I'm content with my career, and so from my perspective, I made the right choice.
So when you moved where did you go to school? Did you always live in Florida, or?
So actually, I'm close to a Florida native, which there's not too many of us. I'm actually originally from Ohio, but my family moved to Florida when I was 3. Grew up down here. And actually, even my parents moved to Boca Raton in 1988. So actually, I grew up where I'm practicing now is the community that I actually grew up in. And actually, believe it or not, the house that I bought is 2 minutes away from the house that I grew up in. So I really didn't stray very, this was always my home. So I went to, actually stayed here to go to medical school. I went to Nova Southeastern University, which is an osteopathic school. So I actually literally commuted from, lived at home, commuted every day to medical school, and then went away to the Northeast to do my residency in New York and New Jersey, but experienced a little bit of winter and knew that was not going to be the future for me, and eventually met my future wife and said, I'm not living in the Northeast. I want to move back to Florida. She agreed, and we moved to Boca, and I've been back here practicing in Boca for the last 19 years. So actually, the job I took out of residency, I practiced for 12 years. And so eventually 7 years ago, I transitioned to concierge. But I've been in the same hospital for 19 years in the same market, working with a lot of the same doctors. So I've gravitated towards what I believe is a great place to live, and I have family here, and there's no reason for me to ever go anywhere else.
I want to, do you have kids, siblings around the area?
Yeah, so I have three children. My daughter is a senior in high school, so getting her ready
Mine
for go to
too.
college. Oh yeah. I know.
Yes.
So right, we're at that point where she's trying to figure out where she's going to go to college. So thankfully, she's got a lot of good choices. And then I have a son who's in ninth grade and another son who's in seventh. But in Boca, my parents are still alive and they still live in Boca. I have a brother and sister-in-law that live here in Boca Raton, and then I have another brother and sister-in-law who live in Hollywood, Florida. So really, for me, family's important, and I'm blessed to have so much family that's local. So, like I said, is that
They,
Boca's nothing's perfect, but it's a pretty darn good place to live and to raise a family.
well, I'm taking notes because I want to touch on a few things related to being a sandwich generation, caregiver, as well as what does the future look like for the next gen patient. But also, uh, before we, as you percolate on those topics in the next few minutes, let's talk about what drew you to concierge medicine. Like, how did you find out about it? Boca is a very popular area. Florida has got a large population of snowbirds. And so what kind of drew you into concierge medicine? Because years ago, there was a stigma around it, and that's changed a lot in the past few
Correct.
years. What's your thoughts on
Yeah.
all that?
So look, I've known about concierge medicine for a long time, even before I became a physician. And the reason being is so my parents, as I said, is who live here in Boca Raton. So they've actually were they were patients of one of the originators of concierge medicine, Dr. Robert Colton, who was started
Yeah.
MD-VIP. So, as you mentioned, there was a stigma. Dr. Colton, of course, took a lot of abuse and
Yeah.
scrutiny over obviously he took a lot of the bullets for the rest of us because now it's become fairly standard. But back then, obviously, it was unfortunately it was scrutinized and they took a lot of abuse for it. So my parents actually were some of the first people to go into concierge, and obviously they got great care. When I first started my traditional practice, when you first come out of residency, you're very idealistic. You don't, at that point, I would have told you I would have never done concierge medicine. I would have thought that, why would I would never desert my patients or feel like and part of it is as you practice longer and longer, you start getting an idea of what medicine is like and what the care system is like. Um, there was a really a major turning point in my life that really kind of pushed me to go in the direction. So like until that point, until I was 39, I'd been in practice about 9, 10 years. I was seeing 30 patients a day. I'm on staff at a hospital. I was seeing patients in the hospital, but I was at the hospital at 6:45, 7 every morning, rounding, going to the office. And then I was also going to 2 rehab facilities. So really I was working really long hours. I was not spending time seeing my kids and I was really the kids would be still asleep when I left in the morning and they would be already asleep by the time I got home at night. So I would see them on the weekends. And then when I was like 39 years old, I started having some abdominal pain. And the short of it is I ended up getting diagnosed with a very rare type of mesothelioma called multicystic peritoneal mesothelioma, which, that was diagnosed here in Boca Raton, but I ended up having to travel because it was so rare. I ended up having to travel to Pittsburgh to UPMC to get major surgery and get peritoneal chemotherapy. And it's interesting because when I was first diagnosed, my first response was, I can't believe I'm deserting my patients. I can't believe I'm doing this to my partners. It was all about, how I was letting other people down by me having this disorder. And then I ended up having actually a very important meeting with actually my rabbi, my clergy. And not that I'm a religious individual per se, but he really said is, look, all these years, all you focused on is other people, and you never focus on yourself. And he says, it's time that you really start focusing on your own life. And after I recovered from that surgery, and I've had a couple since, but and thank God, I'm everything is stable. But it really made me change my mindset of saying is, you know what, I got to start balancing my life. I got to start taking better care of myself. I got to start living life. I want to start spending more time with my wife, more time with my kids. And that's when there was an opportunity to start a concierge program for Boca Regional Hospital. And that's when I saw that. I said, you know what? I think that's what I should do. And right away is I went full bore into saying to my patients is without any regrets and without any, and obviously I had to do it in a very, because some of these people had been with me for a long time, but to me is I said I had to make that change, and it's been a godsend for me ever since, because so I always look at this experience, even though I had this health calamity, to me is it actually made me into a better person, because it really made me reflect on my life, reflect on my career. And I think ultimately is I'm a better husband and a better father. And I think actually, to be honest, I'm probably a better doctor because of it. So I think all in all is it was a taking a negative and making a positive. And I think it's what doesn't kill you makes you stronger is a very good moniker that I live by.
Wow, that is a powerful story. I got goosebumps just thinking about, you know, it's so encouraging because I feel like I have my seat on the bus in concierge medicine is I get to probably talk with, I'd say 95% happy doctors every single day, right? Like there's always a few outliers, but for the most part, everybody's very happy of the physicians. And it's encouraging, but also discouraging because you see that, there's 90% of doctors out there who are practicing medicine and they're good at what they do. They like their lane. They like being in that system. They like being in a hamster wheel and they like doing surgeries. I remember talking with my hand surgeon after a pretty traumatic whittling accident, which is funny. But I remember asking him, I was like, I've heard you go in and out of these doors over the last half hour while I've been waiting in here, and it's fine. I was like, it's the same thing over and over and over. And he's like, oh, I just love the trauma. Like, I love the trauma of the surgery. That's the part I really love. I love the science behind it. I love being able to fix these things. This is the stuff I have to get through in order to get to the stuff I really love. He's like, I love 80% of my job. It's the 20% that we all have to deal with. There's always something about your job and my job that we don't like it, but we have to do it because that's what we have to do. And I love what you said that it makes you a better doctor because that is so encouraging. I hear that so often from the concierge medicine community that moving into concierge medicine has helped them be a better dad, a better spouse, a better doctor. And I want to touch on for a moment, just take a rabbit trail for the idea of letting people down because that seems to be something that guides a lot of people, a lot of physicians is, I was taught to be everything to everybody at all times, make no money and wear it like it's a badge of honor. And, I remember one physician, he said, my wife, when she was in medical school, was treated like she was 6 inches tall. And, granted, you're treating the human condition, life and death in a lot of cases. But on such as that you enter the workforce, you enter into a family, you enter into, friendships and in a workplace where you're now feeling like, well, I've got this incredible burden that I wake up every single day. And, it's not fair to ask these things of me, but I signed up for this. I didn't sign up for easy. I signed up for worthwhile. So when you were wrestling with that, letting people down, moving into concierge medicine in particular, how did you wrestle with that internally? Did you involve some of your peers? Because we can all go and get the affirmation from people that we know are going to give us the right things that we want to hear. But it's also important to get the words of affirmation or like, nah, you're not seeing a blind spot here. How did you wrestle with that? And what was your colleagues' response to your move into concierge medicine?
So, I already had, I had a couple partners who, kind of knew that at some point that I was going to be looking to go into concierge. I don't think it was a complete surprise, but also is many of my patients had known about, the issues that I'd gone through. And actually, some of these patients, there were some patients who had actually already seen, had maybe had another doctor turn concierge and then ended up seeing me. So there were some people who actually had already been through that before and then basically kind of, they realized that how busy it was and that they kind of, some people did see the writing on the wall that eventually it was going to happen. But for me, at no point, by the way, first of all, at no point was I never made the decision based on anything financial. I was doing fine financially in the practice that I was in, but I wasn't happy. And I was also going to burn out at the pace that I was doing. So to me it was sitting down with the patients, and a lot of the patients, by the way, they would always complain about they, had trouble getting in to see me. They would always end up with my PA or nurse practitioner. I would sometimes get this line, "You're harder to get into than to see than the Pope."
Mhm.
So part of it was that, it was frustrating knowing that I can't take care of everybody, and and look, thank God I was providing concierge level care, but I was providing it to a large number of people. And at some point, you just can't provide that care to, I had probably over 2,000 patients. So at some point is that just that model wasn't going to work. So for me, I look, it's hard to have that conversation with patients, but I didn't feel guilt because I felt like I had to make the decision. It's not that it didn't feel bad if a patient hypothetically couldn't afford it. But that being said, is I still had to. And what I did was before I left, I made sure to actually we hired another doctor who was going to be taking over my practice. So as a result, is I wasn't like deserting the patients, but ultimately is I was leaving them in the capable hands of another doctor. So to me is I gave people, if people wanted to join me, they were more than welcome to do that, and a lot of them did. But for those, and by the way, over time, I've still had patients, and I've been doing this now 7 years. I still get occasionally an old patient who will pop up and say, you know what, I should have done it years ago, and now it's time to do it. But to me, sometimes you have to put feelings aside and realize that you have to just make the decision, and it's not that you don't have emotions about it, but at the end of the day is you have to still do what's best for you, and I think that's was the lesson that I eventually took me a long time to learn, is that I had to still do what's best for me, my family, and obviously the longevity of my career.
Well, and our guest today is Dr. Aaron Klein. He's with Baptist Health Concierge. And before we jump off this, this trail and put ourselves back onto the main trail, if you were to talk about what you're doing now and why you did it, and you were to go to where you went to medical school and speak to a young group of doctors who are, you know, again, the stigma of concierge medicine has changed a lot. It's much more positive. They can't keep the current hamster wheel, it's not sustainable for that. But if you were, there's that ethical, you know, dilemma that is being taught. I remember I was talking with uh, somebody who was a medical school professor years ago, and she came to our conference and was speaking on genetics. And she's like, Michael, it's not only going to take an act of Congress to change how we're educating physicians, it's going to take an act of God. And then you see things like the pandemic happen. and how quickly insurance companies moved, and you're like, oh my goodness, we've been waiting for that, and it took you 3 months to figure that out. Like, oh wow, we are, like a lot of things change with all that. So if you were to talk to a group of young doctors who are struggling with this ethical dilemma of like, well, patient abandonment, or I don't want to leave anybody behind, what would you tell them?
So I think the message is first of all, I don't want to discourage young minds because, obviously they're very, like I said, even when I was coming out of medical school and residency, you're very idealistic about the future of medicine. That being said unfortunately, the healthcare system as we see it, especially in primary care, it's a dying field. And that's the real problem is that, by the way, most of these kids who are in medical school, they may do an internal medicine residency, but probably 95% of them end up specializing anyways and not going into primary care. So the truth is that the system as it stands that puts really no emphasis on primary care, it puts no emphasis on really a lot of preventative medicine. Ultimately, what it does is it just continues to drive up the costs of the healthcare system because we're more of a reactive system than a proactive system. So, unfortunately, there's going to be less and less people that go into primary care. I do think that actually having done the traditional system to start actually worked out great for me because ultimately I think became a very seasoned physician. I saw a lot of patients. I feel my clinical acumen and clinical capabilities were very honed by the time I went to concierge, because the truth is that when someone pays money for a concierge physician, they want to know, they don't want to see someone right out of medical school, out of residency. They want someone that's been doing this for some time and has a lot of experience. So like someone right out of residency, you would not necessarily hire them to do, become concierge. But to be honest I don't find it to be an ethical issue, mainly because, unfortunately, the way that the system is set up, unfortunately, drives you to make these decisions. If the government and if the healthcare system changed and put more of an emphasis on primary care, then I think people wouldn't have to go into concierge medicine, because the whole idea, unfortunately, is primary care physicians are underpaid. The only way that you can, generate income, unfortunately, is to see more and more patients. That's just the way it is. And unfortunately, the more patients you see, the less time you can spend with them, the less personalized the service is going to be. And so, look, if they started subsidizing education to people that went into primary care, or started giving people, incentivizing them to become primary care, then I think that would definitely potentially save it. But unfortunately, it just doesn't look like that's the direction that it's heading in. So to me, like I said, I didn't abandon my patients, mainly because I set them up with care that they could have. I actually gave them all 6 months notice also, so it wasn't like I suddenly pulled the rug out from underneath them. So it was not abandonment. But to me, I didn't feel like it was unethical, because concierge has been around for several decades, and a lot of the patients understood. Not to say, you have a few that were upset, but for the most part, a lot of the people, in Boca Raton are used to the concept of concierge medicine, and so I think I handled it as well as could be handled. Even when I wrote a letter to my patients, I really wrote a very heartfelt, heartfelt message to my patients about how difficult it was to make a decision, because it was. I mean, it wasn't like I wanted to do that for a long time, but ultimately I think they realized, because a lot of people got to know me over the years and they knew how genuine I was, that ultimately it went over well.
Yeah. Well, and I say it very often is, it's no longer about being the best doctor in the world anymore. It's about being the best doctor for the world and for your patients and for your local community. And our guest today is Dr. Aaron Klein with Baptist Health Concierge Medicine. We're going to get into what the program is like at Baptist Health, what that transition was like, what your patients are, the types of patients that you have. But before we do, I want to jump onto one last rabbit trail related to the next generation of healthcare providers and what is that going to look like for you? Because we both have kids that are, going to be making my daughter, yes, just yesterday, I was like, hey, we got a 401k letter from your employer. I know you're a senior in high school, but this is a good opportunity for you to learn how to start saving, because now you're turning 18 and these opportunities are going to come for you, and you need to start thinking about, I know you're only 17, but you gotta start saving for your future because it adds up. And they're going to be facing these decisions when they get out of college about, who do I go to? Why do I go to this doctor's office? Or, am I gonna be faced with, just maybe the easiest way is to use an app. They think about things differently than we do. And we talk a little bit about the primary care, less and less, everybody specializing for the most part. It's not well paid. It is kind of the something that is important. However, as a patient sitting on the other side of the exam room from my doctor, from my, allergist, whoever I'm seeing that day, is and sitting with my kids is just like we're not taught to balance checkbooks or all these types of things in school or college, we're not taught the difference as patients between internal medicine, family medicine, primary care, osteopath. Like these are all terminology that we have to learn on the job, so to speak, before we make a decision. I remember my wife chose for me my initial primary care doctor when we first got married. This was well before concierge medicine today. And she's like, well, I knew that he went to North Dakota and you went to North Dakota. So I figured y'all would be friends. And I was like, that sounds like a great idea, and it turns out we were. And then he eventually went into concierge medicine, which is funny. And we had long conversations about that. But, you know, there is uh, a likability factor. And I don't like to use that. And I know that probably makes some physicians listening wince, but my wife, for example, her doctor has to look at the medical chart just to remember her name. And she's been there for 20 years, right? And so when the allergist who, will give her the time of day or a PA will look at the results of her, test results and spend 45 minutes, it's reasonable to think like I would much rather see the PA because they're giving me the time of day. They're versus the doctor who's never available. I don't even know if she's even in today. What's your thoughts on the future of the next generation healthcare? What are you excited about, encouraged, or discouraged about related for your
So
kids?
I would say that I'm a bit on the discouraged side, just because, and by the way, part of the reason people go into concierge medicine is because they feel like that's the only way that they can provide quality healthcare to their patients. And, and unfortunately, as I see, about the stories about people waiting extended periods of time to get in to see doctors or can never get in to see the doctors or, exclusively seeing, mid-level providers. So look, it may be getting in a situation where there may be patients who are technically on a doctor's roster, but they may never see the doctor and only see their mid-level provider because they're only coming in for urgent care stuff or because they don't want to wait extended kind of periods of time. So I think accessibility is becoming a major issue. And look, part of it is because unfortunately the workforce, I mean, there's less doctors going in. And by the way, there's also less doctors going into the field of greatest need. I mean, just to give you an example, and I'm not disparaging these fields or anything, but I mean, in every other block, we have a dermatologist here in Boca Raton. Like people can't find a primary care doctor who is not concierge, who's taking patients. They can't find primary care, but you can find 50 dermatologists like here, or plastic surgeons, or and like I says, I'm not disparaging; those are great fields, but we're pushing people more into fields that we don't have need for or demand, and things that really have the greatest need is primary care. Unfortunately, is a bit of a dying field. Like nobody is going into it for so many reasons that we've kind of already discussed. It's like a thankless field. I mean, it's actually interesting because what I do I still go to the hospital, take care of my hospital patients, and and obviously I'm in the office. And even till COVID, I was going to rehab facilities. But what I do with that facet of going to all these different places is a dying breed. I mean, most doctors either are hospitalists that you specialize in hospital medicine, or you are an outpatient clinic. So like, fact is, I don't find that that's a good thing. I love being able to see my hospital patients, and I find that the continuity of care that I provide, but obviously the continuity of care is going to start becoming a problem just because everything is getting so specialized, and as a result is the care is becoming more impersonal. So I do think that unfortunately these are a lot of things that are a bit on the discouraging side for patients, and a bit on the discouraging side for the providers who are going to be coming out. I think on the discouraging side also is the fact that I find that the next generation, the work ethic is not maybe the same as it was in my generation. I find that it's a little bit more about, I would call, an entitlement generation, and I include my kids in that generation. So sometimes, I work, even though I do concierge medicine, I still work extraordinarily hard, and I'm very devoted to my patients. But I don't know if the next generation has that same necessary hard work ethic and dedication. And I think that even in residencies, they get a little coddled, with all the work restrictions, because when we were in residency, we really worked very long hours. But to be honest, is those long hours are what made where we are today. The fact that we're very seasoned physicians, and if you entitle them and you give them, don't work them hard enough, essentially is they're not going to come out as good doctors. And that, so I find that in the residencies, they're not pushing hard enough per se anymore. I think, though, on a positive note, I think the technology and all the technological advances that we have, whether it's AI and all the advanced imaging, all the advanced genomic testing and blood work and things like that. I mean, obviously, the level of care and knowledge that we can get, where you can almost develop personalized medicine to patients, I think is going to be invaluable, and it continues to grow. So that part, utilization of technology, I think is phenomenal. But I think the impersonal side is dropping off, and that's really when I do my pitch to patients of why they should come to concierge medicine, it's because we know you, we get to know you, you get to know us, we provide personalized care, so that every patient matters to us. So we don't, that's why to us is we keep that old school type of approach, which is where you get to know your patients, and the patients get to know you. So you are on that first name basis.
Well, now I want to pivot over to your to Baptist Health Concierge program. And was this a program that had already been in place, or was this something that you had to bring to the administrators, to your colleagues, and say, look, there's other places in health systems and hospitals that are doing this. We need to lean in and pay attention. What did that look like? What did those conversations talk?
Sure. So actually, Baptist Health only came to be about 3 years ago. So I originally was employed by Boca Raton Regional Hospital, which was a standalone hospital in Boca Raton. But Boca Raton had a lot of concierge medicine up to that point. And I think what happened is the hospital started realizing there was a lot of concierge doctors in the community, and that they were losing some of the business to some of their concierge doctors, some of the concierge doctors in the community. But also is they had a lot of donors in their foundation that were asking for a concierge doctor, and they were sending people to outside doctors who maybe were utilizing other hospitals. And so I think they looked at it as a way to support some of their donors. So originally they didn't have a program. They were looking to start a program around the same time that I was, and I happened to have to know, because I was on staff at Boca Regional for many years. I knew the CEO of the hospital, and I had heard about and I put my name in for that to start the program. And I got the position. And basically what they said to me was, this is your concierge program, start it, do it the way you wanted to do it. So they actually gave me kind of carte blanche to really start it from the ground up. I had a hand in everything in terms of the model, in terms of the pricing, in terms of the contracts, in terms of how I envisioned the member panel being. So they were great in terms of supporting me. Obviously, as you start at the very beginning, there were a little bit bumps along the way, but I can tell you that it grew and flourished very quickly. And then actually, when Boca Regional formed a strategic partnership with Baptist Health, which is a major healthcare system in South Florida, because they wanted to build, they were growing so quick that they wanted to build a brand new hospital, actually. So Baptist Health ended up putting in, actually, so between private donations and Baptist, there's now a $1.3 billion project that's in the middle of being done, with a brand new hospital, and a lot of new centers have already been constructed. But Baptist Health obviously saw the vision of Boca Regional and has put a lot of money into it. So now, but it was interesting because when Baptist Health took over, so Baptist Health is, I think it's either 11 or 12 hospital system. I was the only concierge doctor in the entire hospital system of 12 hospitals. At the time, because they absorbed my contract, but it was unclear whether they had any interest in doing concierge medicine. So actually, I wasn't sure whether I would actually have a long-term future with Baptist Health. Then after working with them and really showing them the benefits of concierge medicine, they really came around. And now we've actually, here in Boca Raton, we have 3 doctors, a third who's actually almost completely full, and hopefully we're going to be looking shortly for a 4th doctor. And then we've actually expanded now to the Miami market. So they just opened up a concierge office in Miami, and they're also opening up one in Key West. So Baptist now is starting to branch out to other sites throughout South Florida to grow the hospital-based concierge practice. But really, the part of it is the hospital looks at it as a win-win, because they have doctors that are employed by them who, obviously support the hospital. So, we're not forced to, but we send a lot of our, imaging and a lot of our ancillaries to the hospital. But in the same token is a lot of our patients are ultimately big donors to the hospital. So, so it makes sense that, that the doctors that they should be seeing, are affiliated with the hospital that they strongly support. So that's kind of, so at this point it's been, we literally continue to get inundated with phone calls, and the model, thank God, has been great. And there's just, to some extent, actually, there's more patients than doctors in this. We have a lot of people that want concierge medicine, and in this town, a lot of doctors are even capped that they're not even taking new patients. So the market is very strong here in Boca Raton, and even continuing to grow. It never ceases to amaze me about how well it's doing. Like, I'm friends with a lot of other concierge doctors with other programs, and we're not competitors, because there's really in Boca Raton, there's more than enough patients for everybody. It's a flourishing model here in Boca Raton.
Yeah, as long as, I think I think there's a kind of an amnesia that I was listening to a psychologist the other day talking about when you read a news article and it's on a subject matter that you really know, like, for example, you would really know about osteopathy, right? And it's like, that's not right. Like, what they're saying isn't right. And then you go and you read something about, like, tires, and you read something on tires and you're like, yeah, that sounds right. Yeah. We kind of forget this, like, what we're reading. If you're a subject matter expert, it's like, that entire article is not accurate at all. You know, just like when you're reading it, you're like, only 5% of this article on osteopathy is accurate. Um,
Mm.
how is a hospital system based concierge medicine program different from two things? A traditional plan reimbursed practice versus and a how is it also different from a independent concierge medicine practice?
Sure. So first of all, is even the site here is a little bit different than some of the other sites. And the reason being is, so like for us, all the doctors that are affiliated with the one here in Boca Raton, we actually all do go to the hospital and admit our patients there. Some of the other sites, they are only doing outpatients, and they utilize hospitalist programs at some of those hospitals. But the truth is that to have, I would say that to have the support of the hospital is big. As I mentioned, they just literally put in a $1.3 billion capital campaign between private donations and Baptist Health to build a whole new campus. So like for us is to be part of a really strong, flourishing hospital system really allows you to have the infrastructure as a physician to really provide next level care to your patients. So like for me, like for example, like I can get my patients in for tests, I can get them in for, physicians, hospital physicians very quickly, because I have that strong connection, to the hospital and to the hospital system. And because they want us to, succeed. And as a result is we have that mainstream type of communication that we can make that happen. When you're obviously an outside physician, you may not have that type of connection or that type of ability to get people in as quickly as you'd want to for some of those types of opportunities. But look, I mean, one thing that was really even very telling was so when because I was employed when COVID hit, I was already employed by Baptist Health. So when you're employed by the hospital system, I didn't have to apply for any type of loans. I didn't have to, the PPP program literally is my paycheck kept coming every other week. I didn't have to worry about losing my job or about furloughing employees. So as a result is really being part of a strong that hospital system gave me during that really difficult time gave me a lot of real kind of job security in that regard. And also is like it says is even I was continuing to grow during COVID. So from my perspective is, look, there's positive and negatives about being an independent versus working for the hospital. I think that, you have to always realize you have to make a list and say which has more positives and which has the least negatives. Because I find that when I was in private practice for 12 years and I had frustrations and things that bothered me too. So wherever you're going to work, I think what I would always tell the next generation of doctors, there's no perfect job. At the
Yeah.
end of the day, you're going to have frustrations about any job that you take. But at the end of the day is as long as those things are outweighed by the things that you love about it, and because to me, even though I work for a hospital, they never tell me what to do. They never tell me how to care for my patients. They never tell me where to send my patients. They don't micromanage. At the end of the day, as long as I'm providing great patients and I have good Press Ganey scores to them, they're thrilled. And good patient satisfaction. So at the end of the day is working with a hospital. It's stable, it's secure, it's got a huge future for our system. And like I said, it's not always right for everybody, but it was right for me. And plus to be part of a system where I can be a leader and I can be a director of a program to me is and be an expert in something to their system was a huge plus to me.
That's awesome. And I love to hear that you're happy, and I was talking with somebody last night at dinner. And he's like, he's a retired executive, and he's like, look, if you can find a job that gives you 80% of your time spent every year that energizes you, that you really enjoy. And I remember my guidance counselor in college saying that too. He's like, you may be really gifted and called for a purpose to this particular job setting, and you're really good at it, you know. But there's always, always, always going to be something about that perfect job that you're not going to enjoy. You know, like I don't like the HR side of, work, and I don't like I'm not good at numbers. That's why I married a math teacher. You know, she's really great at numbers. And nonetheless, I'm glad to hear that you found a career in a sustainable model that is good for you and also good for others. But let's talk about your patient population as we kind of come in for um, our descent on our conversation with Dr. Aaron Klein today. He's with Baptist Health Concierge Medicine, and Dr. Aaron Klein is our guest today. And we'll put the links of how to connect and learn more about Baptist Health Concierge and connect with Dr. Klein. We are starting to really see, in the last probably 5 years since COVID, really hot health systems and hospital systems, embrace concierge medicine across the US. And, in speaking with other concierge physicians who are abroad, but also here within the US and Canada, within health systems too, is, the patient and the member population. When you initially, started this, am I under the correct understanding and assumption that you kind of had already a busy patient base of records to lean into, so that it wasn't like, all right, let's put on my sales hat today. We're going to go recruit some patients that don't know me, like me, or trust me yet. What was that process like for you? What does the member panel look like for your system, not necessarily for others, but is it, well, and I'm going to throw another wrench into the engine here, is the subject of fairness and arguing fairness, because some people hear this like, well, yeah, you're able to do all these great things for concierge patients because they're subscribing patients, but what about the rest of us? And as a Canadian, who's probably the last Canadian on the planet to think that concierge medicine's kind of a cool thing, and talking
Yeah.
with Canadian physicians who have worked on both sides of the border, there's pros and cons to what we have here in the US and what they have up there too. So talk to us a little bit about the member panel. What does that look like? And, what's your thoughts on it overall?
Sure. Yeah, so actually, as I had mentioned before, is that so 6 months, prior to me making the transition to concierge was when I sent out the letter and gave people notice. So that I would have to say that 6 months was probably one of the most stressful, difficult, times in life, because during that time, it was every patient who came in, you had to discuss with them about the transition, about what you were doing, and you, to some extent, even though the patient still knew you, you still had to feel like you had to sell yourself to some extent, and convince your patients why concierge medicine, would be kind of right for them. So really, you did have to, even though a lot of people knew you, still had to do a bit of a sales pitch, because at the end of the day is that they're still investing in you. The one line that I would get a lot and was, oh, concierge medicine, it's for rich people, or it's for people. And what I would, when I first started, is I charged $1,800 per person per year. So I would turn to them and I would say, mathematically, and it's interesting because most people don't look at it this way. I said, most people spend $5 a day, or the equivalent a day of what that concierge medicine, without even thinking. And people say, well, I don't know. And I said, you buy probably a Starbucks coffee every day. I said, if you multiply that 365 days a year, that is about the cost of concierge medicine for your year. But you'd pay that without even thinking. But it's because people had ingrained in their head that, medicine, unfortunately, was always entitlement, that, you didn't have to pay the doctor, that ultimately is, they took insurance, and so, that was, sometimes you had to change people's perspective and say, look, you know what, if you care about your health, then you can prioritize it, and you just, so you know what, you go out for a couple less dinners occasionally, or maybe cut back on a vacation or something, or maybe what it is. But if your healthcare is a priority to you, then you can do it. Don't get me wrong, if people are on a fixed income, maybe a different story, but a lot of my patients, in Boca Raton, it's happens to be a little bit more of an affluent area. So a lot of people, it was just more that their mentality was they didn't want to pay because they had never had to pay before. But I would say
Yeah.
that most of my, probably 75% of my payer mix is probably Medicare. So I have probably more of a geriatric population, but then the other 25% are young. I have some people as young as the early 20s who are young people who just want to have access. But then I also have some people who are very busy executives who, want to know that when they're sick and, that they need to get in, that they're not waiting several hours, or they can get in when they need to. So I really have, seniors who are, who are well off, and then I have some who I've, some patients who are multi-billionaires. So I have a really interesting mix of patients. But I think that's what I love about it, is the fact that I have such a diverse kind of patient, and no two are the same, and it, it continues to make things very interesting, on a routine basis. But I think the one thing is that if people nowadays prioritize their healthcare, they can budget themselves potentially to afford concierge medicine if their health is a priority to them. Because people spend a lot of money on things that they think are a priority. So if you prioritize your health, then a lot of times you can facilitate it.
I can see the wheels turning in some of the listeners. A couple of questions, and I got a review the other day. It said, Michael asks all the pesky questions that we want to know when we're driving down the road. And so I'm going to ask a pesky question that I can see that, a physician who's listening can think like, okay, I'm in. Like, I get it. I want to do something like this in my area. Do I have a boss? Does that boss tell me who I need to see? And do they dictate my time? And are they making demands or requiring me to see certain patients that, and I know the answer, and I know this isn't an easy answer for you, but I can see the pesky questions coming up of, I'm not sure if I want to work for a health system because I have been burned before.
So, so for me, I at no point do they micromanage me at all. You know, part of the nice thing about it is that I almost never see my supervisor, and it's because of the fact that they love the care and the program that we do. So as a result, is like we may not see my VP of operations. I may not see her for months, and it's because what, the only if they're in your office a lot, it means that you're probably not doing things right, and they need to. But the fact is that they don't tell us where to send our patients. They don't tell us how to care for our patients. At the end of the day, as long as you have, great, your Press-Ganey scores are good, as long as you're getting great feedback, as long as your numbers are good. At the end of the day, look, when you look, I'm not going to sugarcoat it. When you work for a healthcare, system, they are looking at your dollars and cents. So they want to make sure that you're producing. So as long as you're doing what you're supposed to be doing, I mean, honestly, I provide, I believe, world-class care on a daily basis, and I think it's because of the healthcare system and not in spite of it. I think they allow me the tools to be able to take care of that. And I think as long as you're, as long as you're a hardworking physician who cares about their patients and it cares about the quality of the care, and you're producing where you should be, there would be no reason for them to micromanage you or to be pesky in that regard.
Final two. Well, I have probably 4 or 5 more questions, but they can be short or long-winded as you'd like to. But before we jump off of this topic, is the member panel, for those listening, I can already see it. Do they all have to be donors? And what about hospital public relations? Because as a PR guy, it's all reputation management, and you're in an area that is accepting of concierge medicine. but we recognize that for, hospitals are looking at dollars and cents. There are leaders who are seeing different things than you might be seeing in the community and in the media. Talk to us about the member population. Do they all have to be donors? If somebody, what does that look like? And then what does the public relations side for you entail?
Okay, so in terms of the members, anybody can join, this program. So it's not specifically meant for donors. I mean, we happen to have a lot of donors who are part of the practice, but anyone who wants concierge medicine can join Baptist Health Concierge. So it's really opened up to the community. In terms of any type of public relations, I mean, I really don't have to have a lot of public relations just because I've been in this community now practicing for almost 20 years in this community. I was doing 12 years in a traditional model and 7 years. So my name, all the doctors, the specialists, they all know me. I mean, because I've had a relationship with them. So as a result and as they all know that I've built this program. So to me I don't even actually advertise. I mean, because it's like we have a huge feeder system of just potential referrals that we kind of get from multiple sources. So we actually have never even put any, the hospital doesn't like to necessarily do a lot of advertising or to do much social media, which to some extent, could, I guess the downside to that is you can't on your own just all of a sudden start, putting things online and, because that could be problematic without the permission. So if you wanted to know a downside of working for the hospital is potentially, obviously, you have to somehow, muzzle a little bit of what you do. But all in all is because Boca Raton is such a concierge heavy community that there's not really any, backlash or windfall that kind of comes from it just because it's so standard of care here in this community. So as a result is like it says, the demand is there, the interest is there, and to some extent is we just have to keep, believe it or not, finding more doctors. So at some point is if there are people out there who are going to be looking for position, we may be looking.
Yeah, that was my next question. Are you guys looking to hire?
We may be looking for someone soon. So stay tuned.
Well, we will keep us posted on that. We'll definitely, help. There's some amazing physicians out there who are actively always looking to get into concierge medicine, and some of them are really great doctors, and that's up for you all to vet them. And we'll put the links in the show notes of Baptist Health Concierge Medicine and how you can connect with Dr. Aaron Klein to learn more about that, learn more about opportunities, but also just ask him some questions. As we come in for our landing, you can be however brief or long-winded as you would like to on these questions. It's just a few short questions. Let's talk about patient expectations. If I was to join today and you would say, okay, here's what I think I'm going to expect. What do patients expect of you as soon as they join? And is it demanding? Is it a little overwhelming sometimes?
So look, some of the things that people were expecting in medicine were actually things that I was delivering even before I went concierge. So it wasn't that things became more demanding even with concierge because I was actually attentive to my patients even before then. The things that we offer, we offer like same day appointments. So if patients are sick, that if they call before 12, we guarantee that we'll get them in. And if they call after 12, we'll still try to get them in. And if they can't, we'll get them the next business day. But we also, give patients 30-minute appointments. Obviously they have a lot of patients email me and I'm very responsive to email, but they can technically after hours, they can call me nights or weekends. But believe it or not, most patients because I've developed a good relationship, they do a lot of email and they don't want to actually, a lot of them don't want to be intrusive, that they don't actually. So it's not that often that a lot of them will call in the evening. A lot of them actually will email me unless it's a true medical emergency, because they know that I will get back to them very quickly, and that I'm responsive in that regard. But also is that, I get patients like literally the next day I'll get them most of their test results back. Sometimes even the same day I'll get them their test results. Like they'll be on their way home from an ultrasound. They'll say, "Wow, you have my ultrasound results. I haven't even gotten
Yeah.
home yet."
Yeah.
So a lot of it is as they see what we're delivering, they know what to expect. And as a result is I thank God we don't really get a lot of complaints, just because we're so caring and responsive to our patients. And we provide really just such a high level of personalized care that, at the end of the day, look, are you always going to have 100% satisfaction? There are people that unfortunately, there's people that you can provide the best care for, and they'll never be happy. And that's at
Yep.
the end of the day is the
They're only
important thing to
happy when
always.
they complain. Yep.
Right. So at the end of the day is you have to realize as a physician is you can't make everybody happy. You just have to be the best version of yourself that you can be, and take as good care of patients as you can, and show them your level of care. And at the end of the day is, look, thank God most people continue to renew every year, and because they see that and they see how indispensable that the service is. But no, it's very rare that I get people that come in, and if they have unrealistic expectations, it's because they've usually left several doctors already. So
Yeah.
sometimes is if they come in, it's because they may be unfortunately, they may be people who are just chronically unhappy with their doctors, you're not going to be the end of the line for them. It's just going to be the next doctor that they check. So.
Yeah. We did a prospective patient survey it's been well over several years now. And we asked patients who are actively looking for a concierge doctor and leaving their traditional plan reimbursed doctor, and what was the most important factor in that? It was not cost. It was not how much is my concierge program or doctor going to cost. It was, I want to find somebody that I know, like, and trust. And then second, it was convenience. Like, how do I communicate with you? Is over text, over a secure messaging app, those types of things. And then third was cost, but it was only like 11%. So you're looking at like a lot more people are saying, look, it's bad out there. To quote my wife, she came home from a doctor's office visit a couple of years ago, and we exchanged the kids and switch cars and that whole thing as a parent. But as we come in for a landing here with Dr. Aaron Klein, Baptist Health Concierge, um, what does a typical day look like for you?
Sure. So it really depends on because I do still go to the hospital. So if I have any hospital patients, I usually will round on them before my office hours. So my office hours, my staff comes in at 8:30, but my first patient is at 9 a.m. But if I have to go to the hospital, I usually will be there, depending if I have one or two patients, I may get there at 7:45 in the morning. So I am fortunate because when you work for a hospital system, my office is 2 blocks away from the hospital. So it actually works out really nice for me. And actually my office is where the hospital is only about 10 minutes from my house. So it actually is, it just works very nicely. But so I usually will round first, and then from 9, to 12, I'll see patients. And then, maybe, between, I'll take a short lunch maybe, but usually call patients, and call test results back between 12 and 1. And occasionally, if there's a sick patient that I need to add in, I may add them in. And then I'm usually 1 to, 4:30, but I'm not, because it's concierge, depending on the day. Some days you may be full and some days you may be sporadic, but, obviously it really depends. But I would say that on a typical day, depending on the time of year, because Florida is a very seasonal population. So like in the summer, there's some days you may see as few as maybe 4 to 6 patients potentially, because, that's just because people are away for the summer. And then you can see maybe as many as, 16 patients. I would say that, 16 would be on the high side. But ultimately remember, I get like about 30 minutes scheduled, and I remember 16, you may have one of those, two or three of those being an upper respiratory infection. So you don't have to spend 30 minutes with someone who's got a runny nose. So at the end of the
Yeah.
day is, my time is spent so much more efficient and smarter. But plus is you're not like in the hamster wheel that you're feeling that you have to, you're thinking about other patients are waiting for you. You can actually spend the time that you need. So it's a very leisurely, pace. And not to say that there's never any stress, but I would say compared to the stress levels that I had, it pales in comparison. So like to me is every day I enjoy what I do, and I can consider, and I can honestly say that the way that I'm doing things that I can continue, I can envision myself continue to do this for a longer period of time.
That's
For
what matters. Yeah, that's what counts because we need, I always say to folks like, look, concierge medicine is not for everyone. It is for the one who really truly values their doctor's input. Because for me, my doctor's words, 5 words from my doctor they weigh 1,000 pounds. Like he can uplift me, encourage me, or it can be like, hey, we need to talk, you need to come in. And then you're like, oh, and it could completely change the the navigational direction of my entire life. And so, concierge medicine is not for everyone, but it is for the one who truly values an investment in their care. And this is a quick pro tip. I'm not sure how it would necessarily apply to you, but I remember talking with a concierge doctor in Arizona, and she said, one of my favorite things to do as a concierge doc is visit my patients in the hospital, especially when I find out that they're in the hospital. I don't love that they're there. However, I don't want them to feel alone. And I know from a patient who has been admitted to the hospital a few times, I'm left to go back to my internal medicine doctor and say, yeah, so I was in the hospital last week, and he's like, "What?" And I was like, "Yeah, I know. We tried to reach out, your office didn't, whatever, and you never came, and he's like, "Well, tell me what happened." And then you're like updating him, and so I love that. And she went so far as like to say, I even bring them some of the things that are those little homey touches, like an eye mask or, the earplugs, those types of things. And so I love that part of being a concierge doctor, that it's those personal touches that matter. You mentioned, and we have last 3 questions for you. Charity, you're happy doing what you're doing. What energizes you related to some of your volunteering in your charitable works? What really kind of pulls at your heartstrings that you're like saying like, I didn't have time for this before, or I did, but it wasn't a lot, but now I'm really able to give back.
Yeah, so actually, most of the things that I'm involved with actually outside health, outside my job, are actually not even healthcare necessarily related. I do actually volunteer for an organization. Some actually, I'm a Jewish physician, so I do work with some Jewish organizations. Specifically, I work for an organization which helps with Holocaust survivors. And, so I've been able to I do have some Holocaust survivors as patients, who actually I do not charge. Actually, I actually see
I was
them
going to ask
for,
about
yeah,
scholarships, but I
yeah.
didn't know if we had
Yeah,
time.
no, I actually, there are rabbis, Jewish educators, Holocaust survivors that, in my community that I will not charge them a concierge fee. So look, I mean, you obviously have that, ability when you go into concierge to decide whether, and look, you still bill insurance, but you may just not, charge the concierge. But I think a lot of it is with my schedule that I've been able to find, more time to, do things with my family, do things for myself, do things for my community, being, even like if my kids are involved in different types of school activities, that I can actually go and attend their school activities. So to me it really it gives me a lot more flexibility in my life to, to really be participate in things that are, that make me, that are important to me, that are even outside the realm of practicing medicine.
And it's interesting you brought up, your rabbi and the conversation earlier that kind of changed your mindset on some things, because we incorporated an entire breakout session this past October to kind of incubate or beta test the conversation that doctors are having more and more related to spiritual and religious type of conversations, and how do physicians, interact with those dialogues, whether it's in the hospital room or whether it's in the exam room. And so, I think that it's important to I'm just saying all this to say that lean into some of those conversations more if you're a physician, because they do care about that kind of stuff. And regardless of their faith traditions or whatever habits they are practicing, it is something that they're wondering, like, I've got this serious health condition, and, what's your thoughts? Because, you've seen maybe some miraculous things happen or unmiraculous things happen, or hey, life is just not fair. This happened to a really good person. Um, you're welcome to riff on that if you'd like, but the next second to last question is, what is your book that you give away most, or maybe that's sitting on your nightstand, that you would encourage other physicians to read? It could be pleasure reading, because that is super important, but we put together a book list every single year, twice a year. And what's one that maybe is on your Audible shelf right now?
So actually, so I've recently gotten into more of the topic of longevity, and so I've actually been reading several books about, different longevity experts, and about, ways to do healthy lifestyle. And so actually there was a book called Good Energy by Casey Means, that's actually was on, I think it was on the New York Times bestseller list this year. But it's pretty mind blowing in terms of, it really kind of points a lot of the issues that we have with our food supply, our water, unfortunately, about our lifestyle, about how the reason why a lot of people really kind of get sick, unfortunately, is just because of, the way that things that we do on a day-to-day basis, and unfortunately about how, our care, unfortunately, is how society has set us up to be a system that is meant to get sick, and then to wait, unfortunately, until we get sick, until we start kind of addressing the issues. So it really kind of, and so look, some of it's very strong, kind of stances on different things, but it's really kind of an eye opening about, if people really want to start cleaning up, their life, changing their life, being healthy. It has a lot of tips and things that you can do to really make it, like, so actually, for example, is like, for me, I actually, ended up, enacted some of those changes, and I've lost actually over 40 pounds over the last like 4 to 5 months. And
Wow.
and really have, exercise a lot, eat cleaner, don't eat preservatives or processed foods. And so it really kind of opens your eyes to, like, unfortunately, in today's society, there's so many things that contribute to our health issues. So I think it's a very educational book, very eye-opening, and then can be even shocking to people to see. But I think it's the type of thing that people should read, because it can really, on a day-to-day, when they go, shopping at the supermarket, or go to a fast food place, that it may make them think twice before, when they start eating, and things that they consume. So I think
I was listening to a comedian the other day, and he was like, what apps do you not want to have a year-end wrap on? This is, my daughter introduced me to the year-end wrap on Spotify, and it tells you like what songs. And she looked at my rap, and I was like, well, I DJ'd, or I hosted all the swim meets, and so I was kind of doing all the swim meet songs, right? And so she's like, Taylor, why is Taylor Swift in your, year-end rap, Dad? And I was like, well, I think it's probably because because she's got good stuff, but probably because of the swim meets. But one of the ones was like, you went to McDonald's between 11:30 at night and 1 a.m., and you consumed 100,000 calories, like those are not the apps we want year-end wraps on. Our guest today has been Dr. Aaron Klein of Baptist Health Concierge. Our final question for you is probably which story do I pick? But what is one remarkable win or something you're really glad that you did with a patient that you're like, you know what? That I could hang up my spurs. That was amazing.
So look, I mean, it's hard to pick out necessarily one specific case. And the main reason is because I one of the benefits that I find with my model and with concierge is I have a lot of time to spend with patients. But and one of the things that I do is I try to get records before even patients come in, because a lot of times actually you can make the diagnosis sometimes even before. So there's been several times where literally that someone has come in and I have found the answer to the problem even before they stepped in foot, because nobody actually reviewed the records and put everything together.
Wow.
I'll give you one specific case that I just came into that so I had a young woman who was in her 20s who had unfortunately been sent from one physician to the next, and she was complaining of just fatigue and lightheadedness and palpitations and unfortunately she'd just been seeing different doctors who were dismissing her, thinking she was a hypochondriac. So I saw her, examined her, and actually, did right away orthostatic blood pressures, where we checked her blood pressures both sitting and standing, as well as her heart rates. And it was shocking that her blood pressure just plummeted and her heart rates would go up 50 points. And it turns out she had significant what's called autonomic, failure or autonomic dysfunction, and she had what's called POTS, or postural orthostatic tachycardia syndrome, of which, it's not that it's a rare diagnosis, but it's a diagnosis that a lot of people don't think about. So here was like a young woman who was 25 who had been debilitated by these issues for 2-3 years and been sent everywhere. And really on the first visit is being able to send her for a tilt table test and make the diagnosis. And for her, we gave her the tools in order to make her feel better, but it was very encouraging because she never had a name for it. She had always been discounted, and here we were like, this is what you have, this is your diagnosis, this is how to treat it. So for her, I would say that, and sometimes when you have someone who's very young with a major medical problem, sometimes that gives you the most gratification, as opposed to sometimes like, diagnosing a 95-year-old, with something. But someone young who, has a whole life ahead of them, maybe that gives you the most gratification because maybe you just changed their life. So,
Yeah.
So I would say that that would be one example of what I can say is I'm not ready to hang up my shingle yet, but definitely I think that was an extremely gratifying case.
Wow. That's an amazing story. And I love that, you didn't treat her like an inconvenient obstacle. I remember a case where I had not shingles, I had hives for probably 2.5 years, and I would go home and I would take two scalding hot showers a day, take 18 Benadryl, 2 Zyrtex, 2 Hour Clears. I went to see an allergist. I went to my different doctors, doctor to doctor to doctor, on prednisone, put me in the hospital twice, all these types of things. And then finally was able to kind of get it diagnosed. And, within 3 months, it was pretty much gone. And I was like, this is amazing that, so thank you for what you're doing, not treating patients like inconvenient obstacles, and which is a powerful statement, because patients are we're out there doing it alone, and we feel like we're alone, and we have great doctors like yourself and others that are, really pushing the boulder up a mountain, trying to do, the right thing all the time as much as we can. Our guest today has been Dr. Aaron Klein with Baptist Health Concierge Medicine. Thank you for your time today. Thank you for sharing your story. Thank you for sharing Baptist Health Concierge's story. And I know that there are going to be so many that are going to want to get in touch with you. We'll put the links in how to connect with Baptist Health Concierge and to connect electronically with Dr. Klein in the show notes below. I hope that this has been helpful for everyone, and thank you so much for setting an example for others of what it's like to be truly not necessarily the best doctor in the world, but the best doctor for the world, for your patients, and for your local community. Thanks, Dr. Klein, for all you do.
Thank you for your time. It was a pleasure being with you.